When Miss Dominique first came to us, she came after a pretty extensive surgical debridement, and our main goal was basically just to get her back to, being able to do her day-to-day life and comfortably, and trying to keep it as pain-free as possible, and stabilize the wound.
I had a surgical wound that was pretty big. I'm not sure how long it was in inches, but it felt like it was huge. It was very painful, and it was, somewhat traumatizing to have that wound.
I would say what has made it the most challenging was just anatomical location, and the size of the wound. It took a lot of hands.
I was in a short-term care hospital for about 2 weeks. They did wound dressings. They started with a wound vac, one of the big ones that's like a boat motor. But because that was not really working, they went to dressings twice a day. After that, I went to a long-term acute care hospital for about 2.5 weeks. Physically very drained, very tired, emotionally. I try to keep my emotions up. I had a lot of good friends that came and, helped me through that. When at night, when you're by yourself, it's kind of hard. You're kind of just, just laying there in the hospital bed and feeling kind of sorry for yourself. I believe from the Kindred Hospital where I was, they contacted you guys, and they said that when you get home, then you'll be contacted, and they'll start some wound care at the house.
Awesome. So what stood out to you about the team early on?
Just personalities, very bubbly, very, they came in ready to go. It seemed like there was a plan in place. And I really appreciated that, because at that point I was still kind of like not really knowing what was going on, not knowing if this thing is ever going to go away. And I was very reassured very, very early in the process.
Myself and the MIS provider would come and do the appointments together multiple times a week. So being able to coordinate care and just being able to keep her as comfortable as possible to be able to carry out her everyday life.
The convenience for sure. They came in, they were very flexible. The first couple of weeks I was still at home. I wasn't working. I hadn't gone back to work yet. So we were able to come in the morning and do what needed to be done. Towards the end of the process, I started going back to work, although I was working from home, and they were more flexible. If I needed them to come later, come earlier, so I could accommodate my work schedule. So I really, really appreciated that. Home health care is the way. They would come in the morning, generally check the wound. Like when Tana came in, she would do the measurements and take the picture and, say what the progress was. I had the wound vac for the first couple of weeks, so they would fit the wound vac and make sure that that was working well, and make sure that there were leaks or anything like that.
So nutrition is one of those things that a lot of times people leave out of the picture of wound healing, and a lot of the times our patients don't really think about it. And so when we first started with Miss Dominique, we talked to her a lot about getting her protein in.
I was having issues with eating my protein in the beginning, but a couple burgers, a couple steaks, and that's when I started to really feel better.
In order to expect our tissue to heal, we have to have the appropriate protein, caloric intake, and essential nutrients, basically, to be able to expect our tissue to make a difference.
I think when I started to feel better physically, I knew that there was an end. I had my doubts, although I was not discouraged. I knew it would happen, and I asked, how long you think it will take to heal, and they were pretty spot on with the amount of time that it took. But when that physical started coming back, the emotional followed, and then I knew, that I was definitely going to make a full recovery. And that was very, very exciting. It's made it much easier, much more convenient, easier to drive places. I get to go out to brunch again now, get to see my friends, so it's great. Got to go to a great concert the last couple days. This means wholeness. It means being myself again. It means, being able to wake up and, have that happiness, and just not feel, hopeless.
I think home-based wound care model comes with its definite pros, and that's that we're able to see a patient in their home environment. So we're able to, one, meet them where they're at, make them where they're most comfortable, and be able to work into their life so that we hopefully seamlessly work into their life and we're not impacting their day-to-day schedule too much. But another big part of it is that we're able to see what's going on kind of in their daily environment and tailor their wound care to their daily life.
When you can tell that someone really cares about your healing, really cares about you as a person, really cares about their job and doing their job well, it's evident, and it was evident in both of them. I had no doubts that these people would not carry me to the end of this process, that they wouldn't give up on me, and they, didn't let me give up on myself. Caring people, they care about you. You get to care about them. When the process was over, I was like, oh, I was sad, so I was glad I came today because I would get to see Tana. But yeah, they just stick with it. Find somebody that you can work with, and find someone that cares about you, and just get it done.